Justo cuando se empieza. Okay, so we are live now on TikTok.
Okay, okay. We are live on Facebook and YouTube as well.
Okay. You want me to start or I wanna wait a few, maybe a minute just to see. I cannot see if anyone is. ¿Cómo veo si está conectado?
Ahí arriba, en este o en este.
No, acá sí, pero acá. Okay. Okay. Bueno, es un suyo. Okay. Hi everyone. This is Dr. Paulina from Verita Neuro Mexico. I'm here with Yreya. She's one of our star patients, and we're going to talk today about her story and about the injury, the treatments, and everything we did to her. Okay. So, Yreya, please introduce yourself. Let us know about your level of injury. When was it? How was it?
So my name is Yreya Molina. I am 19 years old. I was in a car accident December 20, September 24th, 2023, which left me paralyzed from my chest down, leaving me at T6 to T8 complete.
And how were you before coming to treatment? How was your condition before?
I wasn't able to walk as well on my own, or I wasn't able to sit up on my own at all. I would fall over, and I didn't have any core strength.
Okay, so this is Yreya after her spinal cord injury, and she's telling us about how was the spinal cord injury. And we're gonna talk right now about how was the treatment. So how did you find out about Verita Neuro?
My mom was actually the one that found out about it. She was Googling about spinal cord injuries, and Verita Neuro popped up on Google, so she looked more into it, and that's when she contacted you guys.
Okay, great. Yreya, have you received any treatments before coming to Verita Neuro?
I received treatment in Colorado at Craig and in Houston at Tier Memorial Hospital.
Okay, and how was the treatment compared to the treatment you take here? Like, what do you think you improved there, or how was different in Tier or the other centers with compared to Verita Neuro?
I don't think that there's any comparison. I think that in Colorado they tell you one thing, they're like you're not gonna walk again, so they don't work with your body, and they don't do the exercises that are given in Verita. Also, in Tier, they don't make you like work your posture good. They just put you to walk. However, they don't correct your stance as in Verita. They do. They show you the right way to walk, that you should be walking, and the right way you should be standing.
Okay, okay. And how did you feel the first time you arrived to Verita Neuro? What were the sensations, or what did you feel?
I was nervous.
Nervous.
I was nervous. Yeah.
Nervous, just nervous.
Yeah, I didn't know.
And
what to
after the
expect.
nervous pass, like, how was the, I don't know, the therapist, nurses, everything?
I think that the therapists and nurses are really nice. They don't make you doubt yourself at all. They help you, they push you a lot, and they encourage you to do your best. Like I said, they do help you a lot. Like the way that you should have your postures, they do it really good.
Okay, great. And what were your expectations before arriving here at Veritania? What were you expecting for the treatment?
I was expecting to be able to sit up on my own, to not have to hold on to anything, to sit up straight, and to walk better, have my hip movement work a lot better.
Okay, can you tell the people what kind of treatments did you take here at Verita Neuro?
I got stem cells. Yeah, I received stem cells.
Okay, stem cells and physical therapy.
Yeah, physical therapy.
And all of the program. Okay, so we're gonna answer your questions after we finish with the questions with Yreya, but she gets mesenchymal stem cells from umbilical cordon, and she get that intrathecal puncture and also intravenous puncture. But that's the kind of stem cells that she's getting because there is a lot of stem cells that we can use. But right now we're using mesenchymal stem cells for neurological conditions. Mm, mm, mm. How did you find the stem cell treatment you received with us? Like, how was the experience? That it hurts or?
I was scared. I thought it would hurt, but it didn't. Um, the first round of stem cells that I received, I didn't feel anything. It doesn't hurt. You're just, I guess it just depends on you. I was tired after for a little bit, so I just relaxed for the day. The second round, it didn't hurt, but I was able to feel the when they inserted it, which they said that some new patients started feeling that, but it didn't hurt at all. There's no pain after, you're not sore or anything.
Okay, so the standard procedure is that we do a lumbar puncture, normally two lumbar punctures into an OR. She was really nervous, I remember, like shaking and everything, but she did it really good. So we make two lumbar punctures and another IV puncture. And the other part of the treatment were just physical therapy, a lot of physical therapy, pelvic floor therapy, and different kinds of therapy that she didn't do before. So that's the treatment that she gets here at Verita Neuro. But if you have any question, I have a few questions that I'm seeing right now. We're gonna answer at the end of the questions to Yreya. Okay. So how was your daily life here with us? Like you can tell the people when in the morning you have therapy. How was the day?
It was pretty good. My therapy was mixed. I would have therapies in the mornings and I'd have some therapies in the afternoons, but it went really well.
How many hours of therapy you
Oh,
have, or
I
do
had
you have like breaks between therapies, or how was it?
I had 2 hours of therapies. Um, once a day, 2 hours, right?
Yes, pelvic floor therapy too.
Oh, and also had pelvic therapy in the mornings. So right after pelvic therapy, I'd have a break and then get my physical therapy.
Okay, so the normal treatment, I mean, we have a lot of different treatments, and we have treatment for 1 week, 2 weeks, 30 days, 35 days. But her program was like more neurotherapy and pelvic floor therapy, and also like I told you before, the lumbar punctures and the stem cell treatment. But it's a lot of physical therapy that maybe she wasn't like doing before in the other centers, so that was a little bit different. What is your biggest achievements or improvements so far?
My biggest achievement is being able to sit up on my own. I have my core is much stronger and I walk a whole lot better. Instead of using my arms, I lift up my legs. Mhm.
Okay,
I walk
so you would
better.
say that it's a trunk control and
Yeah,
just
I got more trunk
sitting
control.
by yourself. How is your walking and the other training? What do you can tell us about it?
It was really bad on the other side.
Yes.
Yeah, it wasn't good at all. I thought it was good, but it turns out that it wasn't. I was using only my arms, which was why I would get tired so fast. And then when I came here, they told me that that's not how I should be walking, and they corrected it right away. And so then I corrected it. So they helped me a lot in correcting the right way to be walking.
Okay, great. What did you like the most during your stay here?
I like the like
The therapist,
yeah, I like
Dr. Paulina.
I like the therapists. I liked all the therapists, the doctors, the nurses also. The environment here is it's really good. There's no negative energy. It's all positive. Everyone makes you feel really good about yourself.
I think the other important thing about here is we have a lot of spinal cord injuries patients here, so they can talk to each other and see how is your experience and your improvements and what kind of treatment you take, and that helps a lot with the patients stay here, and I think they feel confidence to talk to other patients, and that helps a lot. Okay. What are your long-term goals for the treatments? What do you want to achieve?
I want to achieve walking better without any assistance behind me with a walker. And yeah, that's mainly my only thing. And my posture, because I'm really my back's really curved and they're fixing that right now with me. And I just want to be able to walk better my posture.
Like improve your walking and posture and everything. Okay. Do you find the treatment work well?
I do, because you do start to notice changes and differences in with stem cells. So I do think it's worthwhile.
Okay. Do you think you talking about the stem cells? What kind of change? I know the drone control and everything, but about sensitive or bowel or bladder, did you see like any other change so far? Because we have more months for to see the results.
I do. I've gotten many changes. Before I already felt cold water, but I'm able to feel heat now on my legs. I'm able to feel pressure when I grab myself, or if I hit myself on accident, I feel that. And with my bladder and stuff, I'm starting to get that sensation back. I'm getting the sensation back of needing to go and the sensation of relief. And with my bowel, it's the same thing. I'm starting to be able to go on my own. And that for me is a really, really big achievement.
I think I don't have the question yet, but I know I'm gonna have it. So, how was your bowel and bladder program before and after taking the treatment? How it changed?
Um, it changed a lot. My bladder was out of control. I had to have a leg bag in because I would pee myself a lot. My bladder was just, it had no control. My bowel program, my bowel, it wasn't ever really that bad. Obviously, in the beginning of my accident, that's when it was really bad, but I got in control of it really fast.
Okay, great. Do you have a message for the people who are waiting to learn more about recovery or who are like doubting about coming or not coming to the treatment?
I do. I think that obviously the process, it takes really long, and you can get frustrated, you can get mad, angry at yourself, but the aftermath of how it works, and when you start to see changes, you notice that it is worth it, that well, yeah, that it's worth it.
Great. Okay, so I think we finished the questions I have for Yreya, but right now we are going to read a few questions that we have for you. So we can also answer questions in Spanish, because I see that we have in Spanish. Hablamos español también. Entonces we're gonna check the questions and then we're gonna answer questions. So, dices que te recuperes, prima. ¿De dónde son? Estamos ubicados en Guadalajara, en México, y en Tailandia. We are on Thailand and on Mexico. Okay. En Facebook no puedo ver. What is your injury? No sé qué se refiere. Well, I don't know what you mean. What is your injury? Is what level is your injury?
I'm
Maybe.
T6 to T8.
Okay, so she's at T6. Pónganlo en español, también hablamos español. ¿Qué más preguntas? Porque se nos va a ir ella. ¿Esto qué es? Facebook. ¿Facebook? ¿Instagram? No, este es TikTok.
Instagram.
Ujú. ¿Qué lesión tiene ella? Yreya tiene una lesión, bueno, T6.
De T6 a T8.
Sí, que fue, bueno, ya lo platicamos en el principio del webinar, pero ella me estaba platicando que fue un accidente que tuvo en el 2023. Ujú. Ok. Mm, para ver si son candidatos, you're asking for The cost of the treatment, we need to see if you're a candidate, what kind of treatment you need, because we have treatment for 1 week, 2 weeks, 30 days. We have epidural stimulation treatment. We have another kind of treatments. So we really need to see your MRI and all your medical files, and then we can make a consultation and talk about prices. But we need to see like specific cases. No sé si quieres agregar algo, Yreya, en lo que estoy viendo, a ver qué preguntan. Muchos corazones. Hi, beautiful. Okay, and another question that I have really often is that if it doesn't matter if you're a complete or incomplete injury, and it doesn't, like you can get the treatment even if you are a complete injury, and you can get good results. Of course, it's not the same. It doesn't even matter if you are the same level of injury, it's not going to be the same results. But you can be a candidate for the treatment even if you are a complete injury. So please reach out and ask about your case. Mira, aquí me la preguntaron. ¿Es solo para personas con lesiones incompletas? No. Justo lo que les estaba diciendo ahorita en inglés es, no importa si eres la lesión completa o incompleta, tenemos que valorar el tiempo de lesión, el nivel de lesión, el mecanismo de la lesión. Normalmente les pedimos una resonancia magnética para hacer una consulta y ver a qué tipo de tratamientos son candidatos, ya que tenemos varios tipos de tratamiento con diferentes duraciones. Pero por favor, contáctenos, están nuestras redes sociales y nos pueden contactar para ver su caso en particular. ¿Vamos? We miss you all the way in Houston. Can't wait to have you home. You're almost there, girl. Esa será para ti. Ah. Okay, so we're waiting for more questions. ¿Este qué es? ¿Facebook o Instagram?
Facebook.
Planes de pago, pregúntanos, porque depende mucho del tipo de tratamiento que vamos a hacer. No como tal planes de pago, pero sí tenemos opciones para a lo mejor ir viendo con anticipación, programando tu tratamiento. Estoy teniendo con ustedes, estoy en fase de próxima cita. Claro que sí, mándanos el nombre de tu paciente para ver si te podemos ayudar a agilizar lo de la consulta y ver qué tratamiento te podemos dar. Saludos desde Culiacán, Yreya. Saludos desde Panamá, saludos Panamá. Saludos, mi niña, échale muchas ganas, te queremos. Yreya is blushing. Su opinión en el inicio del caso de Yreya y hasta el momento, pues la verdad es que bien, era un caso interesante porque Yreya venía trabajada, pero a lo mejor no trabajada como debía haber estado. Ha mejorado mucho en la parte postural, en la parte sensitiva, en la parte de vejiga y intestino, que al final esas son las mejorías que estamos buscando a corto plazo. Ella tiene poco tiempo trabajando con nosotros, sin embargo, también quiero destacar la parte de que ha venido mucho a terapia después del tratamiento de células madre. Todos los días está aquí en la tarde haciendo terapia con nosotros, entonces eso le ha ayudado mucho a avanzar con su tratamiento y pues va súper bien. A ver, pero estoy leyendo con... ¿Hasta qué tiempo puede ser tratada la persona con la lesión? En realidad no hay tiempo. Obviamente siempre les recomendamos que entre más pronto sea después de la lesión mejor, porque a lo mejor puede ser que haya más posibilidades de que tenga beneficios más rápido, pero yo he tenido pacientes de 15, 20 años de lesión que han tenido buena respuesta sensitiva de vejiga, de intestino, motora inclusive. Entonces realmente no tenemos un tiempo como para decirte, si tienes tantos años ya no eres candidato, pero sí tenemos varios tipos de tratamiento que depende del tiempo y del nivel de lesión, es si puedes o no ser candidato. Yo soy el paciente. Ujú. How long did it take for you to see the result for the stem cells, and what was your first sign of progress? Eso es para ti.
I don't think that myself, I don't think that not that I didn't put much attention to it, but I didn't want to pressure anything, like just in case I didn't have any results. But I would say after like a week or two is when I started feeling the hot water on my legs, and I got really excited. So I think that for me it was after a week or two that I started seeing results or changes.
Okay, like the normal time is not, like I told you, is not the same with all the patients, but after putting the stem cells, like 6 or 8 weeks, and we have 6 months to see the results. But the stem cells are not working by themselves. They need to do, the patient needs to do a lot of physical therapy. And that's really important because there is patients that get a stem cells but don't want to do therapy, so it's not going to work in the same way. Yreya is doing a lot of therapy, and that's why she's is seeing a lot of results. But there is patients that they don't want to do therapy, so it's not going to be the same results, even if they are the same level of injury. Te manda saludos tu hermano Guadalupe. Gracias por ver sus terapias en Verita Neuro. Saludos. Saludos, Yreya. Estamos aquí como en Chabelo. Ya. Ajá, ok. Do you help minimal consumptions? See, yes, we do. We need to see the case, of course, and see if he's able to take one of our treatments, but we can talk about the case, and of course we can help you. Entonces, ya son saludos, muchos saludos para Yreya.
Mi familia.
Son nuestros mayores fans. Es seguro que recuperen la sensación de los esfínteres. Es bien diferente en todos los pacientes. Como les digo, la parte de células madre en específico puede ayudar mucho con la parte disautonómica, vejiga, intestino neurogénico, sensibilidad, control de temperatura, control de presión arterial. Depende obviamente del nivel de lesión del paciente. Hay pacientes que les da muy bien con la vejiga, hay pacientes que les da muy bien con el intestino, hay pacientes que le va mejor con lo motor, pero también tiene mucho que ver con el tipo de terapia que lleven después. Yreya ha tenido terapia de piso pélvico, que también es una parte súper importante para que se pueda potencializar el efecto de las células madres y que realmente pueda tener un efecto positivo. Pero estadísticamente hablando, el 95% de los pacientes tienen una mejoría neurológica y existe un 5% que no la tiene. Entonces es muy variable dependiendo del tipo de lesión y de la terapia que lleven. Más saludos para Yreya. Tu tío Edgar. Okay. I think we already finished with all the questions. Thank you for being with us here at this live. Please reach out our social media. We have our Instagram. My Instagram is Palmarin Epidural Stimulation. And I don't know if you want to give your Instagram. But you can reach out and we can see the specific case and we can talk about the treatments that we can offer to you. Ok, ya terminamos. Muchas gracias por sus preguntas. Nos pueden contactar por redes sociales. Tenemos Facebook, Instagram, TikTok. Yo estoy en Instagram como Pau Marine Epidural Stimulation. Ahí está mi número de celular. Nos pueden contactar directamente a los números de la clínica. Estamos con nuestra página, nuestro TikTok, todo. Y las demás preguntas que tengan de casos específicos, por favor, contáctenos directamente y con gusto los podemos ayudar. Muchas gracias a todos. Nos despedimos, Yreya.
Muchas gracias.
Está un poco nerviosa Yreya. Muchas gracias a todos. Bye. Ay, qué.